So I'm Thomas Moore. I'm professor and chairman of the Department of Reproductive Medicine and Women's Health at the University of California, San Diego. I actively practice maternal-fetal medicine as well as do research in diabetes and pregnancy. I think the biggest need that we were looking at is helping an individual who's trying to maintain competency and currency with contemporary research and new clinical findings as an easy way of finding the things that they need to know about for their practice and being able to skim over the things they already know. And so if you order the latest edition of a standard textbook, you have to plow through, yeah, I knew that, yeah, I knew that. Oh, look, there's something new I didn't know. And maybe in a, kind of a modern textbook, there'll be a call-out box with some bullets. But in this book, we have all the key points bulleted, first of all, so very quickly, very easily reviewed. But the updates that are really new within the last 3 or 4 years are all gathered at the top of the chapter and then highlighted within the outline of this bulleted chapter on a given topic. So it really allows an individual to update in an area, let's say abnormal pap smear, very quickly, very efficiently, and when one sees this new article that really changes the way we're supposed to practice, for example, the frequency of pap smears totally changed, not only can I see exactly what has changed and what the new requirements are, but the reference is right there and I can go to it either in my library, or better yet, if I use the electronic version of the text, I can go right to that paper right from within the text. And this is, I think, a really powerful thing for busy clinicians. Certainly, the whole business about health screening is a very politically charged and economically charged and health charged topic, and we deal with those health screenings at multiple places in the book, whether it be mammography, cervical cancer screening, risk of endometrial cancer. All those are updated with the very current information. That was the place where you could go to find out, concisely summarize, the science that underlies most of the principles behind the practice that we have. And so we could always depend, it wasn't a quick how to do it book, it was a book that gave us the strong scientific underpinnings so we could be sure we were doing it for doing the right thing for the right reason. And the book has always been there in that regard. And the current edition has paid similar attention to making sure the science is up to date. So the person, every one of us needs to know the science before we do something to one of our patients or tell her to not do something. Those things are important and kind of things that need to be lying at the top of the chapter, right there, so that we can get to those in a hurry if we need them, and then especially for the busy learning physician to have the science there. Like, well, why are they saying that? What is this about progesterone that could change the way the uterus might deliver prematurely or not? What makes that work? Because the patient's going to ask. Well, Creasy and Resnik has really had, I think, 3 audiences. The first audience is basic scientists who are helping advance understanding about how the human does pregnancy and parturition. And a good portion of the book has a basic scientist writing the important parts of the book so that that part is authoritatively written and understandable. And therefore, all these scientists who are working in these areas rely on this book to get a perspective on these various topics. The second important audience are the learners. Of course, everybody's a learner, but I think, people who are studying maternal-fetal medicine, they finish their obstetrics and gynecology residency, and now they're studying maternal-fetal medicine to pass a board exam. They're required by their board to know all the details, all the science underlying the decision making, as well as the right things to do and what the current literature was. They can be absolutely certain that all that information is in this book. And then the third audience is really the practicing advanced generalist who's having to deal with high-risk pregnancy either by choice or because of unavailability, immediate availability of a high-risk pregnancy specialist.